So in this video, we're going to be discussing SBAR communication. So what is SBAR? SBAR is basically it's a communication technique that's often used by nurses when they're either phoning or communicating with the doctor, and it allows for concise and effective communication. Basically, it gives the doctor the most important information in a very quick way in order for decisions to be made. It's often used in hospitals, nursing homes. Medics also use it. It's a very common, very common communication technique, and it basically helps you not sound dumb. It helps you formulate your what you're going to say before you pick up the phone and phone the physician. It stands for situation, background, assessment, and recommendation. So the situation part. Situation part, you basically state your name and your location. So for example, I am RN, your name here, from Unit 2A. Oftentimes doctors work for multiple hospitals at one time, so it's important to say what hospital you're at as well. State who you're calling about, so that can be as simple as I'm calling about Miss Smith. State the issue, and that can be whatever's going on with the patient. Either she has had a fall, increase in chest pain, whatever. So an example that we're going to be running through on each slide is going to be at the bottom. So hello, Dr. House. This is RN Bob from Unit 2A at ABC Hospital. I'm calling about Miss Smith. She has had a fall on her way back to bed, leaving the washroom. Basically, very quick synopsis of what's happened, the situation. Now you go back. Now this step is background. So you're going to be giving a slightly more in-depth history of the patient. So this includes like admitting diagnosis, any other relevant diagnoses, like the general history of the patient. So we have the situation part done. So now let's go to background. So basically we can put Miss Smith is an 85-year-old female who was admitted 1 week ago from the emergency department for unrelieved angina. So again, in this part we have the age. That's very important to the patient's history. The fact that she's female is also important. Admitting diagnosis, also very important, even if it's not relevant to the situation, like in this example. So ours is a fall, but it's still important to know that the admitting diagnosis was for unrelieved angina. Oftentimes this will help the doctor remember, you know, which patient you're talking about, and it can be relevant in further treating the patient. So we've got SB, now it's A. So A stands for assessment, and basically this is the most important part. How is the patient currently presenting? You're going to put any relevant information into this part of this part of SBAR. It's extremely important. The doctors trust your assessment on this because they're going to be making their recommendations based on your assessment. So you're going to include anything out of range, how the patient is currently presenting, vital signs, extremely important. Always include vital signs for the most part. So on to our example. Miss Smith is reporting severe pain rated at 9 out of 10 in her left wrist after she used it to brace herself after tripping over her walker. Miss Smith is unable to make a fist with her fingers. She is alert ×3. Her vital signs are ... Basically, you're just going to give them a very good assessment of what is specifically going on with this person's hand in this situation. So now we're on to the last part of the SBAR, and that is the R. So it's request/recommendation. So a lot of people get scared when they reach this part, because there are lots of times that you know, as a nurse, you might not know what to do with the patient. I mean, lots of times you might feel that that's the physician's job, but oftentimes you'll have a recommendation for what the physician should do. So as it says here, it's basically what you want from the doctor, but you don't always need to know what the appropriate intervention should be. You can sometimes state, how would you like me to proceed after you've gone through the SB and A portions, because you might not know. Important part of this is if you're calling the physician, always have a an order sheet and pen ready when you call. So whatever the recommendations are, you're going to be able to write them down, and you're not going to be scrambling for a pen and looking dumb at the end of the day. So for this situation, you could put an SBAR of, I would like an increase in her pain medication and a stat chest x-ray. How would you like me to proceed? You can combine many things. Basically, you're asking, what should I do next? This is a SBAR. You've given them the situation, everything about the patient. Now you're going to be working as a team, as an interdisciplinary team, in order to do what's best for the patient. So that's pretty much it. If you have any comments or questions, please comment below. Subscribe for new videos every week. And if you have any recommendations for any videos that you would like to see, just comment below as well.